मैं दिख रहा हूँ ठीक ठाक?
बहुत सोने अब भाई वैसे सोने लगता बंदा।
Go.
Hello everyone. I'm Dr. Ramandeep Kaur. Can you see me?
Yes, ma'am. Hello, everyone. I'm Dr. Jakpreet Singh. I welcome our both the panelists and all the attendees to the webinar. Good morning, Dr. Ramandeep, ma'am, and all the attendees who are welcome. I welcome you all. I'm Dr. Jakpreet Singh, HOD from Mansarovar Global University, Department of Physiotherapy. Dr. Ramandeep Kaur, ma'am, she is a sports physiotherapist from UK. She is the director of IPHY, that is the Physical Therapy and Fitness Clinics. She is working for the Healthy India, for the awareness of physiotherapy, and for the promotion of disabled sports person. Today, she is with us. Good morning, ma'am. I welcome you. And she'll be taking the topic, Beyond the Bruising, Can Cupping Therapy Speed Up the Sport Injury Healing? After ma'am, I would like to welcome Dr. Namrata ma'am also. Dr. Namrata ma'am, she is from Ujjain. She is taking the topic. I think Namrata ma'am is here. Okay, so Namrata ma'am will be taking a topic, pelvic floor workout for males and females, the newest trend. Good morning, Dr. Amandeep ma'am. I would like to welcome you on behalf of Mansarovar Global University and giving us such a time for the webinar. I hope the student will be benefited from your presentation and your webinar. Ma'am, to you, ma'am.
All right. Thank you so much. Thank you, Mansarovar Global University. Thank you, Dr. Jakpreet Singh. And thank you all the participants. We will start off with it. I'll tell you a few things about myself as well. Hope you can see the screen as well there.
Yes, ma'am.
Right. So start off with my company. I am from IFI. It is a health, wellness, and fitness. We are all consultants, and we have a big team all over India, abroad, and here it is. I'm not able to go to the next one. Yes. So I'm going to start off with the topic only straight away because let's not take much time. So the topic for today is Beyond the Bruising. I will explain how and why have I kept this name. And I'm going to tell you more about cupping therapy and how does it speed up sports healing. Right. So a brief about myself. So I did my BPT from Guru Nanak Dev University and MPT from Sheffield Hallam University. Certified in cupping therapy and dry needling therapy. I'm a chief physio to Physical Education Foundation of India, a physio to Fit India, and I'm a physio to National Sports Promotion Organization, recognized physio by a Ministry of Youth Affairs and Sports, and national physiotherapist to Wheelchair Cricket Team India. And I have my own company, IFI, as I told you before as well. Great. So, what are those weird bruises? We've always got this question from the players or from the people around, right? What are those bruises? If you want to see those bruises, I will straight away go to those bruises first. Just give me one.
Your screen is not visible. Please share it.
Is it now visible? Just hold on. Is it visible now?
No, ma'am.
Ma'am, same procedure. Share screen. Go to the share screen button. Same procedure.
Yes, it's visible. They say. Is it? Somebody just messaged it's visible. Is it visible now?
No, ma'am. No.
No, ma'am.
No. Go to the share screen button. and then open that window.
Mhm. Host disabled participant screen sharing. Did I do something?
Repeat, sir, please allow.
It's not coming.
Repeat, sir, you are the host.
Sir, I'm allowing it. Ma'am, it's done from my side.
My screen is not moving anymore. Yes. Can you see it now?
No, ma'am.
No? I'm really sorry. Ma'am, you are visible, but I don't know. Somebody's just sent this message, but the screen is not visible.
Ma'am, host is enabled already. The same procedure, that green button share screen.
Yeah, I did, but it says host disabled participant screen share.
Now it's enabled now.
All right, okay, I'll do it again. It's not showing it right now.
Repeat, sir.
Eight minutes. Sir, please see. I have made you the host.
Is it?
It's enabled, ma'am. It's enabled. You
Okay,
can do it.
I'll
Yeah,
do it.
please go ahead. Share the screen.
Yes, it did not. Yes.
Perfect.
Have to
You
be
can enlarge
enlarged, right?
the screen.
Okay,
Yeah.
right. So we've got this question many a times that what are these bruises, right? I will tell you what kind of bruises they actually are in the following pictures, and these bruises have always been attracted. I mean, people have been very that what kind of bruise are these? Right, we have been very curious as well in the beginning when we didn't know about cupping therapy. So people are like, what kind of bruise is it? So in the beginning, if I talk about the society, they always used to say, just do some icing on the bruise, or they used to say, apply some cream, apply something, so that these bruises go. But then we actually knew that these bruises are like from the cupping therapy, and this is a new trend. This is a new trend for the new society. So cupping therapy is an ancient form of healing, and it relieves the sore muscles, the achy muscles, and it provides pain relief all over, right? And the players always say that it always relaxes my muscles from the soreness, and it makes me more flexible. So the players always try to get cupping therapy in between the meets as well, and before and after the game. And people actually calling them bruise is not a right thing, but we people need awareness for that. And who is going to give awareness? We, the physiotherapists, and we, the healers, right? So that's how we have come up with this topic and the name beyond the bruising, so that every physio, every healer should make sure and aware everyone that these bruises are not just bruises, but these are the healing the circles, I would say, for everyone, right? So that's how it was. So here is cupping therapy. Okay, so there are different kind of cupping therapies, and I am going to explain everything here and then. So what is cupping therapy? As I told you, it's kind of an alternative medicine in which the therapist puts a cup on the skin, and it creates a suctioning. So somebody can just say that we can just create a suction just like that as well, but we can't hold it for long, right? We can't just hold it for say about 5 minutes or 10 minutes, right? So suctioning, it is very easy to do this way, but no, there are proper techniques, there are proper therapies to be followed, right? Can you hear me well, and can you understand what am I saying? Just ping me once so that I can just go further. Is it okay? Just give me.
Yes, ma'am, it is fine.
Is it fine? Great, great, great. So I'll go further then, right? So, okay, I'm going to show you a few cups which I have now at home because I'm not in the clinic. So these are some kind of, this is kind of a plastic cup. Can you see that?
Yes, ma'am.
Yes, and everybody, right? And this was used before. Okay, we had some kind of wood cups. We had some kind of glass cups as well. If you can see this one, right? So these are the earthenwares, the silicone cups, the plastic cups we used to use before. And with evolution, things have been changed. Now we've come up with silicone cups as well. And the gun that is used, the one now I have is this one, right? So we just suction, create a vacuum, and then we put it over. But how? What is the technique that we will do further? Okay. So what does it actually help with? This helps with pain, as I told you. It helps with inflammation, blood flow increase, right? For the relaxation, for the well-being, and for a deep massage muscle of the massage of the deep tissue, right? Okay, so we can't just say that cupping therapy has just started, because it is a very old. It has been uh, evoluted, and it was in Egyptian times, Chinese times, in the Middle Eastern cultures, and in the Ayurvedics as well. So we've been using it for ages. And Ebris Papyrus in 1550, he introduced this, and it has been written in the medical books as well. And there were Hippocrates, Charles Kennedy. There were many people, many researches which have been done before. But for now, it has been a lot of evolution, a lot of research has been done, and things have been changed with time. So, what are the types of cupping? If we talk about dry cupping, I'm not going to the details of this. I'm just going to give a brief about everything, right? So dry cupping is the suctioning. We just do with the cup. We just put this suction and place it statically or dynamically. It depends what the therapist's goal is, right? And we have ice cupping. I'll tell you how to do it, but later on. We have fire cupping, wet cupping, there kind needle cupping. We do it with the needle. There are some kind of herbal cupping. We apply some herbal oils or some essential oils, and then we do cupping. There's some kind of magnetic cuppings. We apply a magnet, and then it is kind of a therapy as well, and which is definitely effective. What are the indications? So, indications. If we go about, so before indications, I would just ask a few of the. Let's see. Can you see me? Oh yes. Okay. So can I just go full screen?
It is already full screen, ma'am.
Okay, I'm not able to do. So I want to ask a few questions to the viewers. Okay, so if you can tell me what kind of indications it could be, can you just drop in some messages so that we get to know, we are interacting. It is not that I am just saying and speaking out and you just blabbering around and it's going out of your head. I don't want that way. Okay, so the lecture should be two ways. It should always be two ways, right? So you have to tell me anything that you're getting out of it. Just
Muscle soreness, skin infection, muscle tightness. These are the answers coming.
actually, I really want to see and answer it that
Ma'am,
way.
you can just see on the chat, ma'am. Chat. If there is a
Question and
site,
answers.
just question answers polls and then chat. If you can see,
I can see more. Oh yes, I can see chat. Yes.
so a
Okay.
lot of answers coming up.
Yeah, I wanted to know that. Okay, great, great, great. So again, one more thing I would like to ask you all. This is really nice. You know, the students and the participants know a lot about it. Yeah, yeah, a lot of it. Very nice. Muscle cramps, inflammation, hair problem. Yes, definitely. Hair problem. Yes, this is a very interesting topic again. Humaira alum, right? Yes, it is a very nice topic to be taken over. Yes, muscle tightness, pain, knee, OA knee, spasm, excellent. Redness, acne. Good, 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 good. Great. So many of the things you've covered. But can you just tell me, have you, you know, any of the viewers and any of the participants, have you been doing cupping before as well? There might be, definitely. Can I see the message? Yes. Oh, yes, I've done that. Good, 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 good. The ones who haven't done, that is, you know, you would get to know more about it. And the ones who've already done, you can just, you know, get a few things if you think it is good. Yes, dry cupping. Yes. Wet cupping is one topic that we can, you know, it is a very different one and we call it hajima, and we can do it later. Okay, great. So the one who has done once, now after this, you can do it multiple times. And, you know, it is a very good treatment and it is very, you know, quick treatment. Yeah, it gave great results, definitely. Jamini Patel, yes. Dr. Patel, yes. Okay, so let's go further. Great. Okay, so here are the indications. Okay, so we have bursitis. It can be used for herpes zoster. I am sure you know, you all are very well aware about all the ones, the indications I'm talking about. So it is for the facial palsy, for the spondylitis. It could be any kind of spondylitis, cervical or lumbar, or, you know, for multiple things. We can use it for blood disorders like anemia, hemophilia, any kind of arthritis, ONE, or rheumatoid arthritis. It can be used for fibromyalgia, fertility, and gynecological disorders. We have some contraindications as well, and we have some side effects as well. I'll talk about that later. But yes, these are the quick indications that most of the ones we have indications, right? Cupping therapy is such a thing, we can use it anywhere, uh, and less contraindications, right? So you have the whole list, and these have been systematically reviewed, right? The pain, we have been reviewing this, and research has been done, and the overall evidence always said that cupping therapy has always given good results. Okay, so should I go further? Yes, great. So technically, if I talk about dry cupping, flash cupping, wet cupping, we have the massage cupping. And what are the techniques? How do we do it? That is a different story, you know. So how do we do it? How do we place the cup? Where do we place the cup? And how much suctioning should be done? That is a different, that can be taken further, right? So what are the methods of suctioning? That is also related. It could be a fire cupping. It could be, as I told you, a herbal cupping, or it could be a magnetic cupping, or we've been doing needling cupping. And along with that, you know, the added therapy, that's what we were talking about now. So was it could be a laser cupping as well, a water cupping, ice cupping. There are multiples. You can just mix and match and do it, and it will give results. And how and where can we use them? People are using it for cosmetology. People are using it for, I'm using for sports, pediatrics, abdominals, you know, for weight reduction. Yes, they are using it for face reduction, weight reduction. Facial, female, you know, they just divide it all over female, male, but it is definitely almost similar. Yes. Okay, so if we talk about the location of cupping, I have a little friend of mine here, uh, here, if you can see him. Him hai, her hai, pata nahi hai, but jo bhi hai. So, right, so anywhere, Just wanted to show this. Anywhere, if you do cupping anywhere on the whole body, obviously not on the skeleton, but on the skin, but yes, anywhere. Okay, cupping can be done anywhere, uh, except the genitals. Yes, we don't do it on genitals, and there are different methods we can, but again, I'm not promoting that for now. Okay, so the location of cupping is all over. We can do it almost all over the body. What are the benefits? So there are different benefits. I will not say that there is just one benefit of cupping. The cupping has different effects on muscles, joints, nerves. So we will talk about that now. Okay. Okay. So what does it do on the muscles? It actually there's an expansion of blood vessels in the muscles, which increases the blood flow. Okay. One thing I can just show you, I'm just wearing a full sleeve, so I can't show you that way, but I can just place it on my face. If I just pull it over, just see, if for the people who've not seen it before, so it creates some kind of suction. If you can see that skin there, it comes over. It is not, because I don't know, it's slippery, maybe because of some kind of whatever the makeup I've put on. So it's here, right? Can you see that skin there? So it suctions up. Okay. So the suctioning of the skin, what does it create? This is creating a negative pressure. Like I told you, if I hold my skin here, it creates a negative pressure. So these cups also create some kind of negative pressure, and then the blood flow increases. What else does it do? It increases the lymphatic pressure as well, and lymphatic drainage increases. It releases the spasm, and it works according to the pain gate mechanism. We will talk about it. We have further slides for pain gate mechanism as well, and we will do that later. Okay, and what does it do for the joint? It increases the secretion of synovial fluid, right? Every joint, almost the synovial joints have synovial fluid, right? So it increases that, and obviously the blood flow will increase in the joint, right? What effect does it do on the nervous system now? It stimulates the nerves of the skin. I'm coming over to the skin as well, and you will get to know which part of the skin will it work. Okay. So it also affects the ANS, the autonomic nervous system, and the sympathetic and the parasympathetic activity as well. So if we talk about the sympathetic, it is associated with fight and flight response. And if we talk about the parasympathetic, it is according to the rest and digest. So the balance is, the homeostasis. Okay. What effect does it do on the blood? We spoke about it. It increases the blood circulation, and it raises the lower blood pressure in the affected area. So there is some kind of cyanotics, if there is some kind of cyanosis. So it increases the blood pressure there, so that the blood flow increases, the blood compositions, they come over, and the nutrients are coming in, and all the dirt is going out. Okay, so again, it influences on the RBCs, the WBCs, and the pH levels. Okay, what effect does it do on the skin? Again, it rises in the temperature, increases the temperature. It promotes the metabolism on the skin tissues, right? And the sweat and the sebaceous glands, it makes a better functioning for them. The salts are increasing, the excretion happens nicely. It also strengthens the renewal of power of the skin. Okay, so when you see further, you will get to know how is it working, and how the pictures I'm going to show you, and it will tell you, give you a clear picture of cupping therapy. Okay, so here it comes. This is the human skin. You know it. Everybody is very aware of it. So till where do we have to go? How much suctioning do we do? It depends. Are we working? What is our goal? Are we working on the epidermis, or we working on the dermis level, or we need to go further down to the sebaceous tissues, subcutaneous tissues, right? So what is our level of goal? What do we actually want to do? What is are we going it for diagnostics, or are we going for treatment? Are we, what is our goal? What do we prefer? What do we want from cupping therapy? That only a physiotherapist or a therapist knows, right? So this works on a special mechanism. Okay, it is not that, okay, negative pressure create kya ho gaya. No, nothing like this. This is kind of a mechanism which actually happens and definitely gives results. Okay, so we talk about reflex zone theory, the pain gate theory. How does increasing blood circulation, there is another theory for that. And how does nitric oxide works on it? What is the genetic theory about it? Right, so there are different levels of understanding for this. So if you talk about reflex zone, okay, so reflex, there are two things. There are reflex zones and there is a reflex arc. Okay, so reflex zone. And so again, just let me know, have you ever heard of these theories? Let's not just make it one way. Yes, I'm sure the ones who are saying yes, they have attended the workshops. Have you? Pain gate theory, so I remember when my first year tha, I guess electrotherapy mein, I used to remember that 100 number page. I just remember that. So we only used to talk about pain gate theory there. Remember electrotherapy? Yes, I remember the page as well. Ah, Clayton, yes, Clayton's 100 number page. If you can check it today as well. Yes, yes. I guess first year, second year. Yeah. Only pain gate, right? So we will talk about reflex zone theory now. Okay. So just to let you know, one very congratulating thing to Mansarovar Global University and all the Dr. Jagpreet Singh as well. We have about 500 plus participants here today, and I actually want to welcome each one of you and really thankful to you. Hope you are enjoying and getting something out of it. Okay. You will get all the certificates, don't worry. Certificate is not what we are actually up to. We are giving knowledge. You just grab that knowledge. Jitni hamare paas hai, we can just give you. Okay. Certificate is nothing. Certificate is what you just show. Keep it for yourself. Okay. Just Mayor Goswami, it's okay. I mean, okay, yes, we need a certificate to for further reference, but the first thing is that we need whatever things we are learning, we need it here so that we can apply. Great, Shreya. ठीक है, Shreya will go further. Okay, ठीक है. Okay, right. So we're talking about reflex zone theory now, and we have the pain gate theory, blood circulation theory, nitric oxide, genetic theory. Okay, great. It's not going further, doctor. Oh yes. Okay, so we have the reflex arc and the reflex zone theory. Okay, so reflex zone, if we talk about our hand, we have all the zones here. Okay, these are acupressure points as well, and we work the same for reflex zone as well. Okay, so we have all the points. I've been discussing all the points and giving brief about it in few of my videos as well. If you see online, you can get to know on my Facebook and my YouTube channel as well. So you get to know. So there are a few points we've been working on, and we can apply cups there so that the suctioning power is created, the positive, all the blood pressure increases and the blood suctioning is there, and whatever we discussed before is done there, so that uh, you know uh, so that the effect, the results of the pain is reduced, right? And it is the same for the foot reflexology as well. Okay, and if you talk about reflex arc again, what is it? So okay, now you tell me, what is the reflex arc? It is by the same name, Dr. Ramandeep Kaur. So you can just have a look. It is YouTube channel, same name, Dr. Ramandeep Kaur. And on Facebook, it is by IFI Fitness and Center, Fitness and Wellness Center. Okay, I'll type it down. You can just join in and you can get to know about the videos there. Great. So please tell me first about reflex arc. Can you hear me? Okay, great. So, okay, so we come over to pain gate theory. Okay, so pain gate. Again, pain gate, you know about it, right? So, pain gate is any kind of deep touch or, a painful stimulus that is going over to your spinal cord, and then it is going over to your brain and then coming back. It is giving results. So if you block that pain gate there, okay, with cupping therapy, it will definitely give you results. Okay. And what is increasing blood circulation theory? It is creating a negative pressure. It works on the physics of the hemodynamic mechanism, and it removes the inflammatory products and the toxins out with the form of maybe, if we talk about wet cupping, or if we talk about any kind of needle cupping, right? Is somebody just asking questions? Yes. Oh yes, sorry, it just missed that. So it is, yes, definitely Swati Malvia. Yes, reflex action. Yeah, it is a sensory nerve, motor nerve, and it is a synapse between this, right? So we just have to block those. Okay. So anything, what are we doing with actually cupping therapy? We're blocking those ways so that pain is reduced, so that the spasm is reduced. Okay, great, great. I have a very intelligent participants here, I'm sure. They're very well versed with everything. Great. I'm so happy with it. Great. So next is okay. So what is nitric oxide theory? Okay. One little question before this. Do you know if we crack our knuckles? This is out of this. Okay. This is out of your this cupping therapy and everything. So if we crack like this, if we crack like this, can you hear that clacking sound, right? So do you know what is it? How does this this sound comes over? If you can hear this. uh Isha, yes, these are popping of gas bubbles. Right, definitely. Just go further. This is like homework for you. You just do it, just find out, these are like quick questions which the patients always ask you, right? Yeah. So oxygen, nitrogen, and carbon dioxide, they're trapped inside, and when you just crackle it, it comes out. It is just a popping sound, nothing else. Don't worry. So it was just to just a quick question to you. Right, great. Okay, so we come over to nitric oxide theory. Okay, so nitric oxide, what do we do is, it is kind of a substance that is released during kind of any kind of trauma. Okay, it could be a small trauma, it could be a small wound, or maybe a fracture or anything. So it is released that time. Okay, what does it do? It actually, how does it function? So the vasodilation, it works on the muscle relaxation, the antithrombotics, and decrease in inflammations. Okay, and it prevents stenosis of the blood vessels. Okay. Okay, so there was a study by Mark Tarnopoisky. Difficult word. Mark Tarnopoisky. Right. So that's a scientist's name, right? He has been searching for it, and there's a lot of research which he did. And he said that massage therapy or the cupping therapy, it helps to repair the muscles, the muscle damage, right? By decreasing the inflammation and renewing the mitochondria. So if you go over to the first lecture of your physiology, right? So we learned about cells and mitochondria, if you remember, right? So it works on that theory. Okay, so cupping therapy is also working on the same thing, and it goes deep inside your skin, and it works on the same massage therapy theory, right? What do we actually expect from a cupping therapy? What do you think do we expect? I'll go back. Okay, so what do we expect from a cupping therapy? Yes, relaxation and feel of being light. Yes, Farhin. Bruising, yes, warmth, muscle relaxation. Very good, very good. Good, good, good. Yes, it increases the blood circulation. We've already discussed this. Redness, yes, it increases the blood flow. Yes, it creates a negative pressure, release of pain. Yes, that's what we are expecting out of it, right? So, yes, we'll go back with it. Okay, so what do we expect? It is a round patch, okay? So it is actually a round patch. It could be anywhere on the skin, anywhere in the body, right? On the tissues. So it results from extra circulation in the area, right? Because it is bringing up a lot of blood inside that suctioning, and so that redness is all over there, right? And there are bruises. That's why we've named it. It is what is beyond the bruising, right? So it is just a bruise. We know it is a bruise, but what is beyond it? What are the things beyond it? What does it actually cause? What is it actually giving to us? Are these bruises good? Are these bruises bad? What does actually give to us, right? So it is actually for the these are the round bruises that we get, right? We get sensitivity to the skin. So we if we after the treatment, sometimes the skin is itchy. Yes, it is sensitive. Its sensitivity increases. Yes, and there is mild irritation as well sometimes. Yes, I'll tell you an incident. Before you give this cupping therapy to any of your patient, you must always ask that there are two kind of patients who are very cosmetologically they're very apprehensive, and they always say कि हमें कोई ऐसा marked body में नहीं चाहिए. There was a patient who had to go for a holiday, and one of my team somewhere in Chandigarh, they did cupping therapy on the shoulder, and she had to wear cut sleeves top or something, and she was actually mad at the therapist. So make sure that you don't do it that way. So you should always, my therapist definitely informed, but they didn't know, they it just skipped that. They didn't tell her that it is going to go in a week time. It actually takes 4 to 5 days to relieve it, right? So the bruise is actually there, but some people, like the ones I'm going to show now, they flaunt their bruises. Okay, so there are two kind of people, two kind of patients. Okay, the ones who don't want to take any kind of bruise on their body, right? And the ones who want to flaunt it. So this is also a very flaunty therapy, I would say, right? I'm going to show you the pictures as well. Okay. Yes. Okay. So we have these. Okay. So healthy blood circulation, you can see here on the skin as well, the screen. So these are all, these can be the ones which can happen after a cupping therapy. These are the skin reactions, and they all are okay. They all are okay. Okay, but yes, the deficiency of blood, I already told you that it is uh, it is used as a diagnostic tool and as a treatment goal as well, right? So it depends how you take it. If you get to know about the blood and the blood deficiency, yes, there is a blue patch. So you get to know, yes, there is a blue patch and there is some deficiency, or there is a white patch, there is some deficiency. So you can tell the patient, yes, you are hemoglobin deficient, so just go have a check. Okay, so again, as I told you, it is used as a diagnostic and therapeutic tool, right? And these have been researched. Many of the researchers have gone with it, and a complete theories have been made. Okay, now let's come over to the side effects. Okay, as I told you before as well, if you guys want to tell me what are the side effects, what could be the side effects, just have a quick let's have a quick chat for it. Great. uh Now, dear, we are up to, yes, what are the side effects? Great, 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 great. All of you almost know everything. Yes, I'm telling you, the viewers are very intelligent. Okay, so the side effects of cupping therapy, it could be, associated again the bruise, right? Some of the patients, they definitely feel some lightheadedness, and sometimes they feel dizzy. But actually, honestly speaking, if I take that treatment, I am very fine. I don't have any kind of problem. Yes, definitely, if I do dynamic cupping, the skin irritates, right? It could be anywhere in the body. So the skin irritates, yes, but it is not that it is very it could be a bit painful, but for that moment it is nothing after that. So I don't consider much of the side effects for now. Okay, but yes, there are some, so we have to learn, because theoretically and practically are two different things, right? So after the treatment, the skin, there is a rim, yes, the ones I showed you, right? They're kind of rim which appears on the skin, and the colors of the skin helps us to find out the diagnostic or the treatment evolutions, right? And sometimes there is we have to be very cautious how we place. Are we applying any kind of we have to be very cautious that are we cleaning the cups so that it doesn't create any kind of infection to the patient. We have to be very cautious about everything. Okay, we are therapists and we don't want our patients to suffer after the treatment, right? So we have to see each and every minute things. That's why we say that we need to do these courses, right? ऐसे नहीं कि उठ के हम आ गए and cupping, I know I can teach this to my 4-year daughter. She just holds it, she can just do it this way only. Okay, and she does it, and she does it wonderfully, I would say. But she doesn't know the techniques, right? She will apply it all over the body, but she will not do it. You also know, she will not know the techniques, she will not know what to do next, right? She can just apply it. Anybody, any of your staff in the clinic can do it as well, but you are the best person. You have to do it, and you have to see the shortcomings, you have to see the side effects, the contraindications, if there are any. Yes, you need to know everything. How do we have to put it, how do we have to apply it, what are the are you using it as a diagnostic tool, or are you using it as a therapeutic tool? So you must see that. Okay, let me just have a look, because there's so many messages there. Just give me a second. Yes, definitely, it is good for old age. Dear, I just want to just finish up this presentation. I will answer all your questions as well later. Okay, I'm just seeing according to what we are talking now, है ना? Great, great, great. So here it is. Okay, okay, yes, there are scarrings and there is hematoma, the bruising, yes. So we'll go further now. What are the contraindications? Okay, so where do we don't have to apply? We know what are contraindications, and now we will talk about where do we don't have to apply your cupping therapy. Okay, somebody asked me that question. elderly ke liye, right? That can we apply it on elders? Yes, you can. Definitely you can. There is no problem. But you need to know if there are any kind of these problems, the ones we are going to discuss now. Okay. So yes, the children below 4 years, exceptions are always there. My daughter is one of the exceptions. We can do it on her because she knows, she's been living with it, right? But yes, children don't allow, they don't, because the reason is they are scared. They can't see those marks there, na? They'll be scared of what is happening there, na? So it's better not to do that kind of a treatment that would give any kind of panic attack to the child or anybody, and the parents will also be worried that, oh, that patch is not going, so always avoid. To the psychic patients, always avoid it, because they will not bear those patches on themselves, because these patches are going to stay with them for at least a week. Okay, so avoid avoid to those patients. Okay, so yes, as seniors, you're the elderly, there is no problem giving it to them. You can use it from, if the patient allows, from 0 age to 100 years, 200 years, whatever the age of the person is. Maybe it is more. So you can give it to anybody, but the patient should be mentally prepared. Okay, so it is your decision. It is the therapist's decision that you want to give it or not. Okay, but yes, we actually avoid according to the psyche of the patient. Okay, and pregnant women's, yes, you can give it to pregnant women's, but avoid, actually don't give it. This is a contraindication. Don't give it on the abdomen or on the lower back. Okay, and if the pregnant woman comes over with a shoulder pain, yes, you can give it. There is no problem. If she wants to get some facial treatments, yes, there is no problem. We had a patient, I'm going to discuss it. We had a patient in pregnancy. She had facial palsy. So we actually gave cupping therapy to that patient. So she was fine after that. There was no problem. Uh, the Bell's palsy, it recovered. There was no problem at all. Okay. It is said that you don't give it to menstruating ladies, but actually, honestly, I give it. Personally, I have no problem with that. So my patients have always relieved pain. So I have no problem giving it that. But this is like theoretical. You have to understand theoretically as well. And again, I'm saying there is a lot of difference clinically and practically. Clinically and theoretically. Okay, so we don't follow every in each line, whatever is written on the paper, okay, or in the books. You follow what is there in the clinic, what is there in your practical world. Okay, so we actually, yes, don't use cupping if you use blood thinning medication. Sometimes they say, yes, avoid. Look, we don't want to take any kind of risk, okay? So if you think there is a risk giving cupping therapy or any kind of treatment, we actually don't give many of the modalities as well to the patients. The only reason is that we don't want to take any kind of risk, because, we know that our degree is on stake for everything, right? So we don't want to take any kind of risk. If you think it is not working, forget it. Let's go to the other treatment. Okay, we're not giving it on the skin burns, right, on the wounds, on the sunburns, ulcers. Directly don't give it on the sun, the ulcer. Okay, and at least learn properly, then only go over, practice properly, then only you can go over to the patient, right? You can't just, as I told you, anybody can apply, but the right way of applying, that you need to learn, that you need to practice, then you can go over. Okay, and okay, well, we can't even use it for the direct artery or any pulse where it is the pulsing nerve, right? One more thing, I would just come back. We never apply on the metastatic cancer. That is a complete contraindication. We should not take that kind of a risk on ourselves. Okay, my things are not going to end. I'm going to blabber all over. I'm sure the time is almost up. I guess I'm not sure how much is left. Okay, Doctor Jagpreet, please let me know. Okay. Okay, so how do we use it in sports injuries? Okay, so again, it works on the same principles that we spoke before, same principles, right? But for the players, we have to give instant results. Okay, we are on the field, they have to play, right? If we are on the field, so they have to play, so we have to give instant result. And how do we give instant results? We just apply it for 5 to 15 minutes maximum, for the player on the field. Later and before or later is okay, whatever how you take it. Okay, that is your decision. But on the field, we need to send the player quickly, very quick. Okay, so for that we can just give a combination of therapies. It could be needling therapy, or maybe some we give ice therapy along with that cupping therapy, so that the action is fast and it gives fast results. So here it is, Olympics. It has been used in Olympics, right? Many of the patients, many of the players have been using it in Olympics. Okay, and it is a new trend, and it is very fashionable. They actually flaunt it. Look, they have it, and they're very confident with it. So you have to make your patient aware that they are confident. Okay, so these are the patients from world, but I'm going to show the ones. Yes, this is my team. That's Dr. Aman, if he is watching. So Dr. Aman is doing cupping therapy on a wheelchair cricket. Yes, yes. So this actually gave beautiful results. So for them, for the wheelchair players, definitely we can't treat everything all together, but these are for the acute injuries. Here, yes, we gave it for the back treatment. Yes, this is also my team. Here it is. The pictures are blabbering here. Okay, so again, you just have to keep in mind that practice, practice and practice. Okay, if you sit down, it is a new smoking. Okay, so if you practice everything, you're doing things, you are you don't have to be sedentary anyways. Okay, so make cupping therapy your new tool, your new diagnostic and a therapeutic tool. It will give beautiful results to you. Okay, and these are the references. There are many references that we followed. Right. Thank you so much. I guess I should stop here only, and we can come up with the questions. Okay, Dr. Jakpreet ji.
Hello, ma'am. Thank you so much. It was a wonderful and an interactive session. A lot of messages and questions are coming up. I will just quickly ask a few of the questions. One question from Anand Madhusudan sir.
Let
Uh,
me just, yes, please tell me.
is bruising dangerous? Because we can see after cupping therapy it occurs. Does it causes pain, and how long does the bruises last?
I have answered this before as well. क्या नाम था physio ji?
Anand Madhusudan.
Anand ji.
Dr. Anand Madhusudan.
हाँ जी, Dr. Saab, I have answered the same thing before as well. Bruising, definitely it causes a patch, okay, and causes redness as well. And it can cause, I showed you that screen, remember? I can just show you again. Just give me one little second. Here it is. So any kind of mark can come over, any kind of mark from here. Okay. So any kind of mark, and these are all fine. We have seen blisters as well. They are all fine. They have no problem. Yes, it goes in a week time. I always tell my patients that it goes in about 7 to 8 days. You take a maximum time so that you are not on risk, right? Because the patient, if the patient is such a patient that I gave you one example. So वो patient तो आपका खा जाएगा दिमाग फिर. Okay, so you have to decide, and you have to tell the patient what kind of what time period will it take. Okay, so it's about 5 to 7 days. That's what I say to my patients.
Okay. Ma'am, next question is from Dr. Riya Panchal. She is saying can we use cupping on field when player is playing in a hot weather condition?
There is no problem. We've been giving it all the time. Definitely, we're not giving treatment while playing because the cup will definitely come out, right? But after that, yes, in between sessions, yes, we do give. There is no problem at all. Hot or cold, or there's no problem. How does it matter? No, it doesn't. You have to see, again, it is you are the best judge of your patient. If you are playing on field, we have been giving it to my patients. You can see the pictures I showed you, they were in between the sessions. Okay, so we can treat the acute pains right there on the field. There is no problem.
Okay. So, ma'am, one question is from Gitanjali Kale. Which type of cupping is most effective?
Again, I can't just promise that dry cupping or wet cupping is effective. You have to see yourself. Again, I have been personally using needle cupping. I think needle cupping gives best results according to me, right? You might be very good at dry cupping. So it depends. How do you practice? What are your practice skills, right? So it is according to that. Hanji.
Okay. So, one question is from
How could we? Can I just say?
Siddhi Kulkarni is asking, on average, how many treatment does it take for someone to reap the most benefit? To reach the most benefit, I think she's asking.
Again, it depends. The sessions in the clinic that we give are from 5 minutes to 25 minutes. Okay. So again, it depends. How do you want to? What are your prospects? What are your goals for the treatment? Okay. And as I told you, in the field, yes, we can't give more than 5 to 15 minutes. 15 minutes, we बहुत ज़्यादा बोल दिए. It's about 5 to 7 minutes. That's what we can give because they don't have much time. They have to rest. They have to do many other things. And the player, we can't just stick to the player all the time. Okay. So it depends upon your goal.
Okay. So, ma'am, next one question we are having from, what are the precautions to be taken while performing the cupping in diabetic individuals?
Yeah, diabetic में देखो, one thing you have to always remember that diabetes patient का healing थोड़ा सा delayed होता है ना. So you must see they should not have any kind of wound. One thing, right? If they have a wound, it will not heal properly, you know. So if you want to avoid, you can avoid as well, you know. But if you think that the treatment can be given to the patient, give it. That is not a problem, but not on the wound directly. Okay.
Ma'am, one question from Rudra Prasad
Mhm.
Patra. Uh, skin cancer cupping is contraindicated.
Definitely it is. Don't give it to any metastasis. No metastasis. I personally don't give. Okay, if you know that this patient has you know metastasis, um, so just don't give it. Don't. Completely no from my end. I don't give it, right?
Is cupping is contraindicated in the patient having fever?
uh you can actually avoid it. Yes, avoid. That patient will not feel good after that, है ना? If you think the patient can react well, and the patient is not like the patient I spoke about, right? So you can give. It is not completely contraindicated. Okay, it depends upon the clinical aspects. I have been giving to fever patients as well, but again, it depends. If the fever is above 100, I would never prefer. But if it is below and the patient is active enough, then it is no problem at all.
Okay, ma'am. So one more question is there. I think last question we can take. Can
What?
cupping therapy used for cosmetic use?
बहुत सारा. Cosmetic people are to just after cupping therapy these days now. They want to use it because it is a new trend, and people are like, people always go to new things. That is the mindset of every individual. You will always see that if you getting any new treatments, they will definitely go over to that. So cosmetically, so they are, yeah, there's smaller cups. I don't have those cups right now. If I can just show you. So I personally use the dry cupping for and herbal cupping as well. And I've got many patients who come up with, like, they say we have fat accumulated on the lower chin, and so we give it to them as well. But you make sure, just let them know that these will give you marks, these will give you bruises, because एक बारी bruise हो गया face पे, और अगर patient ने पकड़ लिया कि why did it happen, then you'll be in a big problem. So make sure that you are making each and every patient aware of it, that these cups will give you marks. So please make sure. And one more thing, please don't give fire cupping if you know it. Don't give fire cupping on the face, because if one person it gives any kind of mark, you'll be bashed up, I'm telling you. So please make sure, don't give fire cupping at all. Okay, dry cupping is okay, there's no problem. You can apply some kind of moisturizer or anything, and then you can do cupping there. But again, you need to learn the techniques. Please don't do the ones who are already doing it, who are certified. Yes, you can do it, there is no problem. The ones who haven't got any certification and haven't practiced it, you know, certification, as I told you before as well, certification is not that important, but practice is more important. How do you apply the techniques are more important. So go according to that. Okay.
Okay. Uh, Thank you so much, ma'am. It was a wonderful session. A lot of interaction with the students and the participants.
Thank you so much.
And, everybody was answering the questions in between also, whatever you asked.
Great.
And I hope all are benefited. A lot of
I hope
good
everybody is
feedback is
benefited.
coming, ma'am.
Yes. So it doesn't end here. You can ask me any question. You can just log into my Facebook, or you can just log into my IFI account. So you can get to know about things there as well. And there is a YouTube channel, Dr. Jakpreet. If you can just send the
Ma'am, I will send the link to
yeah.
everyone, ma'am.
So you can get further information there about everything. My sessions are still going on, and they will go further as well. My videos are there on the YouTube channel and on my Facebook as well. You can follow them, and you can get more awareness about everything. So I am actually working. I want awareness of physiotherapy all over. India is not still aware of physiotherapy. Yes, the metro cities are okay, but if you talk about smaller cities, I am from Shimla, right? uh, but Shimla is not aware of physiotherapy much. They still want to give those 100, 200 rupees and 300 rupees. I'm actually telling you, this is like the worst thing ever, because we're not getting what value we have, right? I live in the metro city. The patients give wonderfully here, but not in the small cities, right? So we need to work together. The physiotherapists all over have to work together for this. This is the awareness that we need to create. I have been giving free sessions to those people for last 5 to 7 years, so that they get to know what physiotherapy is and the quality and the values of physiotherapy. They should know about it, you know. So that's what you have to do. Sirf patient ana is not important. Definitely it is, because of our financial needs, but yes, if you give awareness to the patients, you will get wonderful results, because you will have a quality of patients and a quantity, of course. Right.
Yeah.
Okay, thank you so
Thank
much.
you so much, ma'am.
I've taken a lot of time. I'm sorry, Dr. Jagpreet. And hope to see you all again. And thank you. Please ask any questions if later as well. Okay, there is no problem. Okay,
No,
thank you.
ma'am.
Thank
Thank
you.
you, ma'am. Thank you so much.
Thank you so much.
I would like to welcome Dr. Namrata, ma'am. Ma'am, good afternoon.
Very good afternoon
And
to
Dr.
everyone.
Namrata, ma'am, will be taking a session on pelvic floor workout for males and females. I am also very excited for this topic, ma'am. I have heard this topic from you before also, but it's very knowledgeable and a very good newest trend, as you say it. I would like to tell Dr. Namrata, ma'am, she's a physiotherapist. She is nutritionist, and she is a lifestyle planner also. She is from Ujjain, and she received a lot and lot of awards. It's a huge and a big list of awards she already received. And the one thing I would like to know you all, that she was also nominated for Woman of the Year award by Nai Dunia Media Houses recently, and she has done a lot of work in the physiotherapy field. Without wasting much of her time, ma'am, it's over to you, ma'am.
Thank you so much for the introduction. And just to add one more point to it, I'm just 1 month away from, being a psychologist as well.
Yes, ma'am. I just
Yeah.
forgot that.
No, that's okay. I wish to share my screen
Please,
first so
ma'am.
that I can start.
Please, ma'am.
Can you see my screen?
Not now, ma'am.
Is it visible now?
No, ma'am. Just, it is, but nothing is showing up.
Is it now visible?
Yes, ma'am. It is. Can you
So,
make it
yeah,
enlarged?
yes, I'm doing that. Okay, is it fine?
Perfect, ma'am.
So I would really like to thank Dr. Ramandeep for such a wonderful session. I enjoyed it thoroughly, and I must tell you, thank you so much.
Thank you. Dear.
So see, first to clear a few things, I am at present, I am sitting in a forest area. It is a beautiful forest area, but you know what, I am facing many network issues also. Even we have power cut all over here. I have arranged so many, you know, inverter lights over here so that you can all see me. My video can pause anytime, but I'll make sure that my voice will come to you all. So namaskar everyone, I'm Dr. Namrata Singh. Okay, so I will let's start the session. Let's just not waste our time. I'm here to talk about pelvic floor muscles, pelvic floor workout. And I am sharing a beginner workout over here, and it is the newest trend. See, pelvic floor, I will not get deep into the anatomy of the pelvic floor muscles, but we may have some students over here. So just to brief them, what are pelvic floor muscles? Pelvic floor muscles are, it is designed to keep the pelvic organs in place, and it supports the spinal and pelvic stability. In males, it supports bladder and bowel, and in females, it supports bladder, bowel, and uterus. So this is the basic of pelvic floor muscle which you should know, which everyone should know. In keeping mind about the functions of the pelvic floor muscles, you should keep the 5S in your mind. Keep 5S in your mind for the functions, because to get into anything, any kind of workout or any kind of preventive program or treatment program, you should know the functions and limitations of that muscle which you are going to, which you are up to strengthen. Fine. So when there is increase in abdominal pressure, when you cough, when you sneeze, and when you laugh or jump, uh, these muscles, these pelvic floor muscles contract. These muscles contract around urethra and anus to prevent leakage. So this is the first function, the first sphincteric function of the pelvic floor muscle, that it supports, it contracts when you laugh, sneeze, jump, or cough. So to prevent incontinence, urinary incontinence, prevents leakage. We all know that pelvic muscle provides stability to the core and to the spine. See, when it comes to strengthening of spine and pelvic floor muscles, when it comes to strengthening of spine and core, generally we forgot to strengthen the pelvic floor muscles as well. It is very important aspect when you are treating any spinal conditions or core conditions. It is an important aspect to strengthen pelvic floor muscles also, as it is a stable, it is one of the function of pelvic floor muscle is the stability. Another is pelvic floor muscles acts as a basket for the pelvic organs, and it gives support there, stability. It provides stability, and it plays very important role in preventing organ prolapse. So the another function is support. Yes, the most important function, one of the most important function of pelvic floor muscles is sexual functions. It is usually not talked about function, but this plays a very important role. It helps in erectile dysfunctions also, even in females. When it comes to intercourse, they can there is a lot of problem while intercourse. They can feel pain during and after intercourse. If their pelvic floor muscles are strengthened enough, they will not feel any such pain. It helps the male to retain erection for the longer time. Its sexual function is equally important one. Pelvic floor muscle helps to achieve and sustain erection in male also. And we all know that better the pelvic floor muscles, better is the orgasm. So the main and very important function is sexual also. What is sump pump? The calf muscles acts squeeze to pump the blood towards the heart. Same is the working of pelvic floor muscles, which pump blood and fluid to the pelvis. So this is the sump and pump action of the pelvic floor muscles. So these are the 5S, the main functions of pelvic floor muscles. So this program is basically a preventive program. I will not take much time. I have prepared just a small presentation so that we can finish it fast with proper information so that I can answer your questions as well. So you can see me sweating here. I'm facing a lot of humid conditions here. This is a preventive program. Pelvic floor muscles can help in treatment and in prevention of many things. See, urinary continence. Many of the in many like after the childbirth, after the surgery of prostate in males, and due to some aging conditions, one can experience incontinence problem. So we can treat it through strengthening of the pelvic floor muscles. It can help preventing organ prolapse also. It can ease in childbirth also, because the pelvic floor muscles goes under great tension during pregnancy and during childbirth, especially in the pushing stage of the childbirth. So if the muscles are tense, then it will become difficult for a woman to deliver a baby. And if the muscles are properly strengthened up, it can ease the childbirth. Retaining shape after delivery, yes, it is a major concern of every female to retain shape, a good shape after delivery, after giving birth to a baby. So yes, you can help them to retain their shape as it was before pregnancy by strengthening their muscles, by strengthening their core, by strengthening their spinal stability as well. So pelvic floor muscle strengthening helps in retaining shape after delivery. It can help in relieving menstrual cramps also. Yes, this is one of the myth among many people nowadays, that one should not exercise or one should not work out while menstruating. But here your role is to teach them that no, we have some good workouts, we have some good exercises to ease them during this period. So you can help them by easing their menstrual cramps as well. As I told you, one of the pelvic floor function is erectile dysfunction. It can help in treating and preventing erectile dysfunctions, and it can help in treating dribbling after urination, especially in males. It is sometimes it is a little embarrassing conditions for males if they face the dribbling after urination. So you can help them so that they can relieve from this problem. Now, what is the role of physiotherapist here? See, we as a physiotherapist, we can spread awareness. Nowadays, people in India are very much aware about their health conditions and many things. Even many companies are also investing in making people aware. So it is our duty to make them aware and to spread awareness regarding many things. See, here some many topics are still there which are neglected. Many topics are there which are neglected, and this is one of the major topic which is a neglected one. Neglected, or we can say people feel embarrassed. They don't feel comfortable while talking about their problems. They feel little embarrassed about talking to their sexual problems, to their incontinence problems, even to their therapist and to their doctors. They will not open up properly. So here we play an important role. Here it is up to us to provide them comfort. We as a physiotherapist, we know that what kind of problems they are facing. We know that we should prepare a questionnaire. We should prepare a proper questionnaire for them, so that we can ask them and provide them comfort that everything is okay, you can talk us freely. It is up to our skills. So our role comes here to provide them comfort, so that they can open up easily in front of us and we can help them in a better way. So another thing is, the role of physiotherapist comes here is to help locating their muscle. Locating and focusing on pelvic floor muscle is a real tricky thing. So what you will have to teach them, maybe you will have to teach them again and again to how to locate their pelvic floor muscles. So the one of the best example you can give is to focus on stopping the flow of urine. Ask them to focus on stopping the flow of urine, and the muscles which acts there on stopping the flow of urine is the pelvic floor muscle. But sometimes, you know what, it doesn't provide them with a better knowledge. नहीं उनको समझ में आता है कि how to do that. And one more thing to add to it, just ask them to not to squeeze muscle during urination. It can damage bladder also, and some infections also, can give some infections also. So always empty the bladder while you you're helping them in locating their pelvic floor muscles, ask them to empty the bladder and then perform these exercises. Not exercises exactly, first help them locating their muscle. So the one example is ask them to hold the urine in midstream urine they can hold, and the muscle that is acting is pelvic floor muscle. If it is not that easy for them, there are two more methods. One method in female, you can ask the female to insert a finger in her vagina and ask her to squeeze the muscle. She can feel that squeeze, she can feel the upward movement of the muscle, or ask her to now to stop the flow of urine. Then she can feel the upward movement of the muscle. That is the exact muscle which she needs to focuses on while doing workouts and while doing other exercises. In male, very carefully ask him to insert a finger in a rectum and ask him to squeeze the rectum as if he's preventing from passing gas, or midstream he's holding midstream urine. So in this way, both male and female can be able to locate their pelvic floor muscles. So it is your duty to spread awareness. It is your duty to provide them comfort. It is your duty to help them locate their pelvic floor muscles. Now, there for every workout and for every kind of exercises or any preventive program, there are some basic rules, and make sure these rules are not meant to be broken. Fine, these rules are to be kept for better results. Warm up is one hard and fast routine before any kind of workout. It is one hard and fast rule for any kind of workout. For warm up, you can ask your client just to take some steps on spot walking for 5 minutes, or some static cycling for 5 or 7 minutes. It is enough for doing pelvic floor workout. Always ask them to empty bladder before doing any kind of workout or exercises. You should take their thorough medical history. It is very much required. You should collect their history, any pre-history of any prolapse, or their delivery status and all. Prepare a medical history format also. They should not hold their breath in between the workouts or in between sessions, because see, these exercises are not focusing on breaths. What we have to focus is on pelvic floor muscles. So ask them to breathe freely throughout the session. They have to focus only on the muscle, not on the holding of their breaths, right? So to begin with the pelvic floor workout, the first important exercise comes is the Kegels exercises. We all know that the Kegel, in fact, also works as a warm up also, and it will help in locating the muscles also. So that start every workout with Kegels first. Either it is a beginner session or advanced one. Start any kind of workout with Kegels first. For that, ask them to locate the muscle, focus on the muscle, contract that muscle and hold it for some 3 to 5 seconds, and then relax it. Give a gap of 2 or 3 seconds in between every set of exercise. Start with 5 sets of exercises, then gradually come to 7 sets, and then progression till 10 sets are enough. So two odd and one even, keep it in mind: 5, 7 and 10. These are the progression of the sets while doing beginner workout or advanced workouts. So Kegels, ask them to locate, focus, contract the muscle for 3 to 5 seconds, hold it and relax it. So this is the first workout. I've planned some 6 to 7 sets of beginner workout, which I am sharing with you all. I will not take much of time. Um, so the another set of beginner workout is Kegel 2. First is Kegel exercise, that is a warm up also. Now it is another one is Kegel 2. What you have to do is, in first set of Kegel exercises, what we ask the patient to hold the contraction, right? Now here in this exercise, ask them to rapid squeeze and release the muscles. Means as soon as you squeeze the muscles quickly as soon as possible and release it as soon as possible without attempting of any hold. Just rapid squeeze and release it, immediately release it, and perform this for 5 sets, then 7 sets, and then 10 sets of exercises. This is the second set of beginner workout. I have see because of some communication error, I can't take consent of my patient to share their photographs here. So related to some exercises, I'll have to find some Google images over here, because without their consent I can't share their image in any of my presentation. So just Google images are here so that you can be able to understand what I'm trying to say. अगर उन लोगों से मेरा कांटेक्ट हो जाता तो मैं कुछ वीडियो शेयर करती, बट unfortunately I can't do that. So I'll try to explain it in a better way. There are some 7 sets of exercises. Two we have already discussed. The third one is isometric wall squat. An isometric wall squat, as you can see in the picture, it is different for male and female. For male, the isometric squat should be wide and deep. How wide and deep? Like their legs should be widespread and they should go down deep, like sitting on a stool. It is for male. Here you have to ask them to focus on contraction of the pelvic floor muscles. While going down, they will contract the muscles, hold it there for 5 seconds, they relax the muscle and they come up again. So this is for a male. For female, it should be narrow and shallow. They should keep their legs narrow apart, not wide apart, and the squat must be shallow, not to the stool length, up to the chair length. Chair length is enough for females. Again, ask them to focus on the muscle while going down. They will have to contract the muscles, hold it for 5 seconds, then relax the muscle over there only and come up again. Sets, same 5, 7, and 10 sets of exercises. So this is our fourth set of exercises, which is called isometric wall squat. It is very easy exercises. Ask your patients to wear proper shoes, take a proper support on the wall, and then go down slowly by contracting their muscles. So this is another set of exercise. Fine. Now, what comes is cat and camel. Is we all know that cat and camel exercises, but here we should know what can come under the beginner, what can come in advanced sessions. Why I have planned this here is I have seen many cases. I have observed many of my patients. First, what I did, I just jumbled up all the exercises and start them by doing exercises. But gradually I started to realize that no, this is not the proper way. They are not getting proper, they're not getting workout in proper way. I am not getting good results. So I bifurcate the workouts for them into a beginner and advanced sessions. So now it is we are getting a good results in the patients with many of such problems which I have discussed with you earlier. So for cat and camel, ask them to be on their all fours, contract the muscle. Here, the spine should goes into the concavity, and the neck should be flexed. Ask the client to contract the muscles and hold the muscles while performing this. Then relax the muscles for 2 seconds, and then again goes into the concavity, convexity of the spine, and then hold again. No breath hold should be done. Keep it in mind. You will have to repeat it again and again because many of the patients have the tendency to hold the muscle while doing hold the breath while doing exercises. So it is your duty to repeat it again and again so that it can fit in their mind that we will not I'm not here to hold my muscle and hold my breath, I'm sorry, and to exercise. So just repeat in front of them again and again. Don't hold your breath, just hold your muscle. Focus on your muscle, not on your breath. Breath freely is the main key to do beginner workout. Another set comes bridge. We as a physio, everyone knows that how bridge exercise is performed. Just to add one thing, you should only ask your patient to contract the muscle and then do perform the bridge exercise. Relax it and come down, and then again while getting up, contract the muscles. Now, the last set of exercise is lunges and reverse lunges. Everyone knows how to perform lunge and reverse lunge. If we do it with patients while coming forward in forward lunges, what they have to do is when they are performing lunges and they are coming down, they'll have to focus on the muscle, contract the muscle while coming down, hold it by taking one position of a proper lunge, hold it for 5 seconds, and then relax the muscle and come up. perform 5 forward lunges first, all 5 lunges, then perform reverse lunges. For reverse lunges also the same thing should be done. They will have to go reverse. When they reverse, they come for reverse. The same steps should be followed, like contracting the muscle, focusing on that, contracting and holding on the muscle. In this way, the beginner workout will be properly. You will have to keep in mind the sequence of the exercise. It is important to perform exercises in sequence, because it is easy. Already, see, patient has already in a great strain of focusing on the muscle. Again and again, they are trying to focus on the muscles. First, it is your duty to help them locating the muscle, help them focusing on their muscle, and don't put pressure on them all the time to focus on muscle, focus on muscle. No, don't put pressure. Gradually, slowly and gradually, they'll achieve all these things when they will be so why sequence is important? It is important because once they are perfect हो जाएंगे जब वो लोग beginner workout करने में, तो then they will be able to perform advanced sessions also. So this is basically all kind of beginner workouts for pelvic floor muscle strengthening, for a prevention program, for focusing on the pelvic muscles, pelvic area. So here I come up to the end of my session, because as I promised, I will not take much of your time, because I want to interact more than to just showing my presentation. But yes, if because of short of time, if there is something left for your questionnaire and all, you can follow me on various social mediums by my name. Dr. Namrata's PhysioFit is the my username, where you can find me on Facebook. On yeah, my page is there. And you can mail me also your questionnaires and all, or you can mail Mansoura Global University. They will communicate with them. And I think Dr. Jakpreet, it's better if someone has questions, I'll answer them.
Yes. Yes, ma'am. Thank you so much, ma'am. And
Pleasure.
I'll just ask, there is one question, ma'am, from Rutu Prasad. Uh, he's asking, in prostate cancer, bowel, bladder is incontinence. So will we advise these Kegel exercises for them?
In case of, please repeat, in case of?
Ma'am, in case of prostate cancer, bowel and bladder incontinence is there. So can we advise these Kegel exercises to them?
Not as such. Not as such. It is a preventive program basically first, not when the patient is undergoing some cancer treatment, or the patient is going some chemotherapy and all. We will not ask them to perform Kegels, or we will not ask them to perform some pelvic floor muscle strengthening exercises. Well, at that time, that you will have to focus on later.
One question from Rajat Kumar. If patient is coming with a history of PIVD, then what precautions we can take for advising these exercises?
The history of PIVD, then there is no such precaution that we should take. You should focus on their what is the condition of the patient at present. That's why I told you to take a thorough medical history. If at present also there is some PIVD or any infectious problem is there, then wait for some time. Let them take some treatments. Let them let them recover, and then start with your program again.
Okay, ma'am, Yashvi Joshi is asking, in which trimester we can start with the Kegel exercises?
Start it as soon as you can. There is no such first trimester or second trimester. Once it is diagnosed with pregnancy, usually we'll avoid the first trimester, start with the second trimester. There's no issues.
One question from Savita Bahel. She's asking, these Kegel exercises are very easy to do, ma'am, but they are very difficult to explain to the patient. How can we do that?
That's why I explained you how to locate the exercise. How will you help them to locate their muscles? I have explained it. So do you want me to explain it again, Dr. Jeffrey?
I think she won't it, ma'am. Please explain again, ma'am. Just a once.
See, it is every physio's duty to explain them. What the easiest way is, ask your patient to perform a squeeze as if she is holding the urine, as if she is holding urine, right? Not a midstream urine, not while she is urinating. Just for explanation, ask her to hold the muscle of urination of muscle, right? So that is the exact pelvic floor muscle when we can help them to locate their muscles. The contraction, the squeeze of that muscles is the muscle which she needs to focus further. So that is basically the
Okay.
muscle which you ask her to squeeze.
Ma'am, one question is from Fareen. She's asking any advanced pelvic floor exercises for women postpartum.
Yes, I have. As I told you, I'm sharing beginner workout only here. There are definitely some advanced sessions also, which I have not discussed it here, but there are many such advanced level exercises for postpartum and many other prevention and treatment of pelvic floor muscles
Okay.
diseases and problems.
Ma'am, somebody is asking, actually, Savita is again asking how effective Kegel exercises are in PCOS patients.
Please repeat the question as a pause with the screen.
Ma'am, how effective Kegel exercises are in PCOS patients?
Definitely PCOS patient in any kind of these pelvic problems, the first focus should be on strengthening of pelvic floor muscles, because as I told you, pelvic floor muscles acts as a basket to hold the pelvic organs, and if the organs and the muscle strength is better, you can treat many conditions by strengthening pelvic floor muscles. So it is very effective in that also, because there are for PCOD basically there are many exercises, and it is a teamwork of focusing on their diet, also on their other exercises and other workout also, to in order to weight loss. Fine. If there is the patient is obese, then and if pelvic floor muscles are not strengthened enough, she can experience urinary incontinence. So to avoid such embarrassing movements to her, pelvic floor muscle strengthening is very important in PCOD also.
Okay. Ma'am, one question from Faisala. After cesarean or hysterectomy, after how many days we start with the Kegel exercises?
It depends on the type of surgery. Like nowadays, it is laparoscopic, so there is no such problem. After 10 days, you can ask them to perform such exercises. No such issues. Kegels can be performed. In cesarean, if it is in cesarean, just you'll have to wait for stitches to be removed. That's it. After 10 days, they can start doing Kegels.
Ma'am, Radhika is asking, in case of pregnancy, can we give beginner exercises to them?
Yes, definitely we can give them. Definitely we can give them, because beginner is the easiest protocol of exercise. But you will have to present in front of the patient.
One last question from Nainka Das. What cues can be given so that the patient doesn't use much of their accessory muscles like glutes, abs, and abductors during pelvic floor muscle training?
I'm
Malab,
unable to see the question because it
yes,
is
from you can just go to the question answer.
I am trying to, because this is a big question, right? What cues can be given so that patient don't use much of their accessory muscles like glutes, abs, adductors during pelvic floor muscle training? Yes, the important cue that you can give them is to uh, stopping the urine. So that is the only thing that they will have to focus on, so that they will not be they will not contract glutes or abs in. If they can if you can able to help them locate it properly, they will not use any of the other muscles. So it is up to you that how effectively you are teaching them to help them to locate their muscles.
Okay.
Any other question?
One question from Sharma. Uh, Ma'am, as you said, during menstruation, exercises can be done. So, what kind of exercises can we do? Is there any specific workout for that?
Yes, there are definitely even this beginner workout also you can do during menstruation. See, and there are many other exercises that helps in strengthening of pelvic floor muscles, that in ease the pelvis. basically your focus should be on strengthening of muscle. If your client have a tensed muscle or tensed pelvic bones also, they will not be they will experience definitely pain. Fine. So what you have to do is ask them to perform Kegels and to perform this beginner workout again and again, so that their muscles can be strengthened properly and it will not remain tensed all the time. So during menstruation, you can ask your patient to perform these beginner exercises also, and there are some other exercises also which you can butterfly is one of the best exercises that can be done during menstruation time.
Okay. Uh, Ma'am, these all are the questions that were asked. And thank you, Dr. Ramandeep ma'am and Dr. Namrata ma'am, for giving us this wonderful session and accepting my invitation with a very short time. And
Thanks to you, Dr. Jakpreet, for your effort. You are doing a lot for your, field for physiotherapist and all. And
thank
I hope my session is clear to everyone.
yes, ma'am. It was clear. There was nothing.
Dr. Namrata, this was a very difficult topic, honestly, to deliver. So really, it was a wonderful session from you. And
Thank you so much.
I know, because if I think of explaining it to the patient or to the physios, the fellow, so
I know. And thank you so much. But actually, I'm facing a lot of difficulty today. I'm in a humid situation
but
here, and it is.
nothing happened. It was a wonderful session.
Thank you so much.
And Dr. Jakpreet, so hey there.
Thank you so much, ma'am.
Yes,
Uh, I would like to thank. Yes, ma'am. Please.
he's been coordinating so well. I mean, from the very beginning, and
Agree.
he's been doing it so well. And I would actually appreciate each and every moment of his.
Even he himself is a wonderful speaker.
Yeah, yeah.
He's a multi-talented person. And I really thanks to Dr. Japri and
Thank
to
you.
Mansarovar University.
Thank you, ma'am. Thank you, both of you. I would like to thank on behalf of Mansarovar Global University for giving this wonderful session, and hope to disturb you again for the further topics whenever you get the time and give your consent for the further webinars. And thank you so much.
It will be a pleasure to do it for you and for other physios if they wish to.
Definitely, a lot of questions are still coming. A lot of people wants to have your advanced session, what you told, and some new therapy from you, ma'am. Advanced cupping therapy. There, somebody asked me if we can have one more session for the advanced cupping therapy.
Definitely, definitely. We can actually teach them how to do cupping therapy.
Yes,
And
ma'am.
yes, we can do that.
So we can definitely have one. And thank you so much, ma'am. Thank you so much. And thank you all the attendees who were there and attending the session and webinar. Thank you for being such a support and such cooperation. And stay safe, stay home. Thank you, ma'am.
You too. Thank you, everybody. Thanks. Thank you, ma'am. Thank you.
Thanks everyone. Bye bye.